Hi everybody, I'm Jody Kerzman and this is Moms Every Day. By now, most people have heard about the benefits of chiropractic care in kids. Here today to elaborate a little more on the specifics of that are Dr. Doug Ness and Dr. Sara Weigel from Active Life Chiropractic. Thanks for being here, you guys. Let's start with some of the common reasons parents bring their babies to a chiropractor.
So a lot of the common reasons we see are for colic, ear infections, acid reflux, and more commonly what we're starting to see is these parents are being preemptive in the kid's health and they just want to come in and get their kid checked by a chiropractor.
So when we say babies, give me how young of kids do you guys see?
Well, now recently we've been seeing more of people coming right from the hospital to get their kids checked. The birth process itself can be pretty traumatic. Sometimes there's some pulling, C-sections, forceps even at worst case scenario, which can be a lot of trauma or torsion on the upper neck. And so what we do is we evaluate the spine and we see if there's anything going on in the nervous system. We have some really awesome scanning technology that can figure that out along with our exam. And that can prevent a lot of problems in the future because the nervous system is so delicate, especially in the upper neck. Those nerves go to the ears, eyes, nose, throat. And if there's issues up there, that can cause problems in the future.
So how do you evaluate a baby to see? I mean, they can't tell you if something hurts.
It's very similar to an adult, but they're just a smaller version. So we do a small exam on their spine. That's a big important part. We just palpate their spine. And then along with that, like Dr. Sara was just saying, is we have some scanning technology that we use to non-invasively check out their nervous system and see how it's functioning. So it's really cool because the parents then are allowed to actually see how the kid's nervous system is functioning along with what we show them too.
Talk about that scan a little bit. How does that work?
So the scan, it's non-invasive, like I was saying, and we just go down the patient's spine. No matter what the age, we can do these scans too. That's very nice. And along with that, it shows great information on how well the nervous system is functioning or not functioning. And based off of that and our exam, we can determine how much care a child needs or a baby needs.
And a lot of it is preventative, like before the baby might get colicky or get an ear infection, you can kind of prevent that stuff?
Right. Like I just had a scan the other day. A 2-week-old baby came in, a C-section, and baby just started getting fussy. She's 2 weeks old, but she had perfectly fine first couple weeks of life, and now she started getting fussy. We did the scan. Her scan showed all sorts of irritation on the upper neck down to the upper thoracics. And so mom was like, well, I'm so glad I brought her in now rather than 2 months from now when things really start getting bad.
Other success stories that you guys can think of?
Had a really awesome story of a 5-month-old baby who, for her entire life, she could only turn her head one way and it was tilted one way too. And they were doing all sorts of stretches and things and nothing was clearing up and mom was really hesitant to bring her in. We did the scans. Of course, it showed all tension on one side of her spine, on that side. And so after just a short series of adjustments, she can look straight ahead. Also, she was having problems with digestion and constipation, and that cleared up too. So, and that was an amazing case where she was really quick results.
Kids respond faster than adults.
Very fast.
Yeah.
And it's amazing. A couple stories for me in the summary, a lot of kids coming in with ADD, ADHD, and they're just attention, anything. And I've got a kid on 3 medications right now. He's 10 years old for ADD. And within 3 adjustments, his grandma is saying that his demeanor is better.
Wow.
Which then he'll do better in school, and it just changes these kids' life. And all we're doing is taking pressure off their nervous system by adjusting them very gently.
Wow. Quickly, you guys have a website if people want more information. What is the website?
We do, activelifebismarck.com.
Okay.
And there's plenty of information on there. There's testimonials on there they can check out too.
Awesome. Thank you, Dr. Doug and Dr. Sara, for being here, and thank you for watching Moms Every Day.